Welcome back to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McCrae.
Have you ever watched an old movie and seen a doctor making a house call? Well, a lot has changed over the years, but the family medicine doctor, now often referred to as primary care, is still the first stop for patients seeking health and wellness. Primary care providers care for patients of all ages and stages of life, providing services such as preventative exams and screening, well child exams, pregnancy care, and behavioral care.
Primary care physicians also help to manage chronic conditions and treat minor illnesses. Yes, house calls may be a thing of the past, but what else has changed? Well, here to offer some unique perspectives on family medicine then and now are primary care physicians, Dr. John Wilkinson and Dr. Elizabeth Cozine. Now, what makes them unique is that Dr. Wilkinson is Dr. Cozine's father. So welcome back to the program, both of you. It's great to have you here to talk about this.
Thanks for having us.
Thank you very much.
And we actually both do house calls.
You still, and that's what I thought. I remembered one of the last times that you were on, you said house calls are becoming more common again. How does that even happen in this day and age?
It takes a willingness to do it and some planning and making patients aware that that's a possibility. I made a house call last night.
Wow. When did you begin practicing, Dr. Wilkinson?
I finished my residency at Mayo Clinic in 1981. I was among the first group of family medicine residents to train here at Mayo Clinic.
So, Dr. Cozine, of course, you grew up in Rochester. Your dad led the way for you, and what made you decide that you wanted to be a family care?
Well, I actually grew up in Zumbrota, which is a small town just north of Rochester, but in the Rochester area. And maybe being in that small town is part of why we both still do house calls. But that aside, what I was interested in is the relationships, with the long-term relationships. And in college, I wasn't particularly interested in science, but I watched my dad's career. I watched the career of several other primary care doctors in our family and realized, that would be something I would enjoy and be good at. And it's a great way to have an impact on communities.
So you're not the only two primary care physicians in the family?
I have an uncle who is a family doctor as well.
Okay, gotcha.
So it's in the genes, so to speak.
Sort of.
So tell us your first memory of seeing your dad, knowing what he actually does for a living, seeing patients, going on house calls.
I don't have any memories of him, of not being aware that he wasn't a doctor. Apparently, as a little kid, I would go to the hospital for morning rounds. I was afraid of him when I was a little kid because he was gone a lot, but I got over that.
Mm-hmm.
So how was that, Dr. Wilkinson, when you took Dr. Cozine on rounds when she was a young baby? How did the patients take that?
Well, that was in the pre-HIPAA days, and we didn't worry about those sorts of things, but it was something to connect with the patients, give my wife a break, and just do something fun on a Sunday morning.
Hey, it worked out all right for the Mayo brothers to go with their dad, so it worked out fine.
Did.
So what has changed over the years of working in family medicine, Dr. Wilkinson?
I think people are busier and have more on their plates, and so consequently there's a slightly greater less willingness to wait in the waiting room, to wait while the family doctor goes and delivers a baby or covers something in the emergency room or the hospital. But the relationships haven't changed, and that's the key thing, and we need to make sure that we make ourselves available for those relationships.
And I'm sure you've seen over the years medicine has changed with more technology. How, in family practice, can you stay on top of all the changes that happen in medicine with so much specialization going on?
Well, we said 50 years ago before I trained, and then 30 years ago as I was finishing training, and now that probably 90% of the problems that patients present with, we can take care of in the office. We're collaborating much more closely with our specialty colleagues, particularly as we're taking care of people with ongoing chronic illness.
One of the things that I have learned through interviewing both of you is that there is a primary care shortage of physicians who do primary care. Why do you think that is, Dr. Cozine, and what would you say to encourage somebody to become a primary care physician?
I think there are a lot of reasons. I think one big reason, particularly in discussing it with my medical school classmates, would be the just the breadth of things that I need to know about.
Okay.
You know, I'm in my 3rd year of practice, so I'm very early on in my career, but every single day there are things that I don't know what to do with or I have never seen before. That gets really tiring really quickly. And, you know, being an expert and then coming in and saying, oh, I don't know. So I think that's one thing. I think people are more comfortable when they can definitively say, yes, this is the answer, no, this isn't the answer. And in primary care, I get more and more every day uncomfortable with uncertainty. I think another reason is compensation, which, you know, I'm certainly well compensated, but not as well compensated as other physicians.
Being a specialist.
And so that's, you know, particularly with rising costs of educational debt, people are making decisions about their specialty career based on compensation.
Dr. Wilkinson, did you encourage your daughter to become a primary care, or did you see what she's just describing and saying, maybe you better be a specialist instead?
I always thought she was going to go into the ministry. So I always knew she was going to take care of people, but when she told us at the beginning of 2nd year of college that she was interested in medical school, as I recall, I was surprised.
But Tracy, how cool is it to have your father in the same specialty as you do? I mean, I'm sure there's stories over the dinner table that you go through back and forth, just picking his brains for the experience that he has.
Everyone else gets really annoyed with that. But
Well, when you hear her say that sometimes, you know, having something different every day gets to wear you down, what is your advice to that?
My advice is that in this day and age, probably being uncomfortable is something we need to. If we're not uncomfortable at least a few times a week, we're probably not stretching ourselves sufficiently, and it's just a fact of life.
Yeah, well, that's a very humbling thought, because, you know, as physicians, we like to assume we know everything, and to assume we don't is, I think it makes us better. But I think I think we all look back in our life when you have a great family care provider. I mean, you're so lucky you get to know your patients in a level that we can't, because you have the time, you've seen them grow up. I think that's just invaluable.
And so do you expect that this is what you're going to do, just like your dad, who is, you know, just going strong? Do you feel like this is something that's going to be your life's work, or are you going to become a minister like your dad was? Maybe a Sunday school
I'm
teacher?
not bolting yet, but there have been more than one occasion where I've done both a little ministry at the patient's request versus, but yeah, I do. I think that something like primary care is more of a calling than a career, and I've really got to take the long view, especially in these days when, you know, I've got little kids, I've got a lot going on, and thinking about what do I want for my career over the long term.
And which of your 3 kids is probably going to end up being a physician? No, I won't make you get into that.
I think, you know, actually, you know, that reason you're talking about then and now. Obviously, you know, my dad's a man and I'm a woman, and we've had very different career trajectories, and part of that I have to thank the women of his era who worked hard so that I could have my babies during training, and that was very normalized. And it was fine. And I think being a parent has made me a better primary care provider, and has made it just for great stories, connecting with patients.
I've said the same thing for years. Patients would often say, well, it must be so great to be a doctor. You're a better parent to take care of your family. I said, no, I don't think that being a doctor made me a better parent, but I absolutely know that being a parent made me a better doctor.
Oh, that's very good. Well, we've been getting a history lesson in family medicine then and now with father and daughter, Dr. John Wilkinson and Dr. Elizabeth Cozine. Both are family medicine physicians at Mayo Clinic. It was great to see you again. Thanks for being here.
Thanks for having us.
Thank you.